Welcome to our next session entitled Advocating for Yourself. This is a critically important topic, and we're going to cover a number of different conversations within this topic. Everything from learning how to communicate your own goals as part of your treatment, how you can actively participate in your own care more deeply, and thirdly, how to ask for a second opinion. In fact, what we really want to communicate in this session is that you should not be afraid to speak up and make sure that you are an integral part of your care to ensure that your needs are being met at every level. In this session, we welcome 4 patient advocates who have themselves gone through various different treatment experiences in their own cancer journey.
Thank you, Anne-Marie, and it's great to be here and talk about some issues in terms of self-advocacy and how we've all dealt with our disease and the healthcare system in Canada. We're going to start with Jason today. And Jason, why don't you tell us a little bit about your story? And first of all, where are you? Where are you located? And a little bit
Yeah,
about your
thanks.
story.
Sure. So my name is Jason Manuge. I'm located in Kingston, Ontario. And for visual context, I'm a white male with some gray-brown facial stubble, and I'm coming to you from my home office in Kingston, Ontario. I guess a
And you're
little
known as
introduction to
Cancer
my...
Canuck online. And your
That is
handle is
true.
Cancer Canuck online. So we've been interacting quite a bit. You probably didn't even know that.
I think that's how we kind of found each other for this. Yeah. Um,
Exactly.
so I appreciate you inviting me to speak on self-advocacy today. It's an important topic, and I'm glad to be part of the conversation.
So tell us a little bit about your story, how you were diagnosed, when you were diagnosed, and how the treatment is going.
Yeah, so just a very quick piece of context. So my experience with cancer started way back in 2012 as a part-time caregiver to my mother who had colorectal cancer. So I was able to accompany her to many of the clinical, surgical treatment appointments, and then some of the community care appointments, like with bolus disconnects and line flushes and everything. And during one of those appointments, her oncologist told me, if you ever start to have issues with your bowels, be the squeaky wheels until you get an answer that you're satisfied with. And so what ended up happening was about 3 years after she died from colorectal cancer, I was diagnosed. And so, sorry, not 3 years, 7 years. And as a result of that conversation with her oncologist at the time, it armed me with some information that I needed to be able to become a good self advocate for myself. So, my entire experience living with cancer has been in the context of COVID-19, which has been a strange time in society and in healthcare. But I went through the diagnosis, treatment, and now the surveillance of my stage 3C colorectal cancer during the pandemic. So, way back a year ago at this point, in February of 2022, I was diagnosed with proximal sigmoid colon cancer, so left-sided cancer. I had a bowel resection with no ileostomy. I had 12 cycles of FOLFOX chemotherapy for 6 months, and radiation has not been a part of my experience. So only weeks ago, I had my 1 year follow-up CT scans. So currently, I'm just going through the survivorship phase, sort of no evidence of disease at this point, and just watching and waiting, going through my sort of 6-month surveillance intervals while we keep an eye on things.
And how old were you when you were diagnosed?
Yeah, fair question. I was diagnosed at the age of 34, so I'm 35 now. I'm not very far out of my diagnosis and treatment.
So this is, your situation is when we're starting to see more and more. I was 40 when I was diagnosed, considerably older, and now we're starting to see people your age and even younger being diagnosed. So, how did you feel at that time? You had the history of your mother. You knew that this was a possibility. Was this something that you were always worried about or thinking about? And how did that compare to, for example, your friends? I mean, this is pretty unusual for somebody your age.
Yeah, I mean, I think that when you have a family history, especially with a parent, oftentimes when you're in that situation, you're aware that perhaps you're at an increased risk. So, you're looking and perhaps even aware of some of the different signs that you should be on the lookout for. Um, I wouldn't say that I was actually worried about colon cancer being something that I experienced. Um, until I started seeing, the primary, bad symptom, which is, blood in the stool. Um, but prior to actually having that, my primary symptoms were just anemia and fatigue. I kicked off my exploration of colon cancer with a simple question to my physician, which is, you know, it's peak pandemic. I'm tired all the time. It doesn't matter how often I sleep or for how long. I just can't seem to get my energy levels up. Like, what might be going on there? Which led to blood tests and exploring anemia, treating anemia for probably a period of 7 months before I ended up having blood in my stool. Um, and that's not something that, none of my friends at the time were part of, the cancer community. So for me, it was on my mind, but in the back of my mind because those symptoms didn't really align with my understanding of what colon cancer, how colon cancer would present.
And even with all those symptoms, did you have trouble getting a colonoscopy? It sounds like you were being treated
Yeah,
for anemia without that.
yeah. So in March of 2021, I had an appointment with my doctor to discuss. It was a telehealth appointment because it was peak pandemic. But I had a conversation with my physician about, this fatigue and everything. And it was 11 months between that appointment and my diagnosis. Just everything that sort of happened between then. So chasing down treating the symptoms without understanding the root cause, exploring anemia, taking the iron supplements, stopping the iron supplements, having my iron levels tank again, and then ultimately I ended up with blood in my stool. And then it was a 4 month wait between that appointment and my colonoscopy, which is ultimately when I was diagnosed with colon cancer. So basically, like, it was a bit of a journey. So, I think it was 7 months between my conversation about low energy and when I had blood in my stool, and then another 4 months after that before I was able to get.
So, as a self advocate, were you able to do anything to push this along? And how did you ultimately end up getting the treatment?
Yeah, I think that probably the key moment in my self advocacy was when I was in my doctor's office getting like a digital exam, which I wish it was digital and not digital. But anyways, I think many of us have had those. And she was like, she was saying, perhaps there's just like a hemorrhoid somewhere that we can't find, like maybe internal. Maybe just wait and see if this clears up. And that moment was when I just said no, we've been chasing this for half a year now. Like, who are you referring me to today? And I think that had I not asked that question, um, things might look very different right now. Maybe I wouldn't be having this conversation. So I think that just understanding the severity of that particular symptom as it related to my family history really empowered me to be able to just ask for what I needed. Um, and to be completely honest, it never really dawned on me that fatigue and anemia would be symptoms of colon cancer until much later on, because those weren't symptoms that were familiar to me through my mother's diagnosis, who is the only other family member or person even that I've known um, up until my own diagnosis who had colon cancer.
And how did the treatment go? Tell us, were there a lot of side effects? What happened?
Yeah. Treatment went to plan. I will say that much. So I did have a bowel resection laparoscopically with no issues. I healed up pretty quickly, was back on my feet. I like to be outdoors and doing hikes and stuff, so I was able to get out. And I think within probably 3 weeks of having my resection, I was able to just do like a 5 kilometer trail walk. So you can imagine that at that point, I was feeling pretty good. Um, Chemotherapy, on the other hand, was an interesting experience. I think treatment went well. I did have side effects. My primary side effect was fatigue, but I ended up also developing peripheral neuropathy from the treatment. So, although I finished in October of 2021, I still do have, some numbness and tingling in my fingers and toes. But generally, the side effects were pretty mild for me. I didn't experience any nausea. I didn't have any, neutropenic fevers causing me to go to the ER or anything like that. So I would say that I guess in the scheme of things, I would say treatment went well, and so far it's done its job. There's no evidence of disease at this point. And just to clarify for folks, like I did do um, 6 months of full Fox chemotherapy, so every other week I would have my infusion and then have the take home bolus pump for a couple of days as
Right,
well.
right. And it's that oxaliplatin in the FOLFOX that actually causes some of that neuropathy. Well, great. Well,
Yes.
continued success. And we're going to come back to you. We'll have a little discussion. Hopefully, we're going to have some time. And next, we're going to speak to Jocelyn Laidlaw. So, welcome, Jocelyn, and tell us from Calgary how things are
Yeah,
going and a little bit about your story. And thanks so much for being here today.
thank you, Barry. I'm really honored to be here. Some people may already know my story because I'm a news anchor and I've spoken out publicly since my diagnosis in the winter. If we go back to spring of last year at the tail end of the pandemic, I was recovering from a mild case of COVID, like a lot of people, a little Omicron, and I got over that. But when I got over that in April, I noticed I found a lymph node in my bikini line in the groin area, close to the surface, and it was hard and round like a marble. I've had swollen lymph nodes before after an infection or a virus, and you get over that. But this one wasn't going away, and I went to my doctor. I saw my doctor multiple times about this lymph node, and we did 2 ultrasounds about a month apart. Both seemed to say there was nothing to worry about. That's how the doctor interpreted those reports for me and told me, probably nothing. It's probably just leftovers from COVID. I didn't feel great about that, but as time went on, I asked for blood tests. I asked for some basic scans and things to find out what might be happening. With those
So
ultrasounds in particular.
you actually had to ask for it. They weren't offering it. You were pushing it
So
along.
I had to push, and that was my first act of self advocacy. Was I wanted to do another ultrasound at a different clinic, and we did that. But the report came back similar. I was ultimately offered the choice to leave that lymph node in or to take it out. Nobody at any point said it could be cancerous, which in retrospect, of course, it should have been treated as though it was cancerous. We should have assumed it might be unless it told us it wasn't. So fast forward to September, the wait to get that lymph node out. And I did get it out in day surgery. And within 4 days, they called to tell me it was completely cancerous, full. It was not lymphoma. And that meant that it was coming from someplace else. And we raced over the course of the next couple of days to find the source of that. And it turned out to be colorectal cancer, rectal anal cancer. Um, and it was a fairly large tumor. Ultimately, they staged me at 3A with 6 lymph nodes fully involved. And the cancer had spread from the tumor into some adjoining tissue and muscle. But had I, and my second act of advocacy for myself was to say that lymph node comes out because I was offered a choice and no doctor seemed terribly worried about it. And something inside told me, first of all, I don't want this in me, whatever it is. And second of all, it just doesn't feel right. I honestly did not think I had cancer. I just felt nobody was taking it very seriously. So my first advocacy was to say more tests, please, more, please, and the second was get it out. And I honestly, Barry, Jason, and I honestly believe at this point that had I not insisted on that lymph node being removed, I would be stage 4, and somebody would be patting me on the shoulder and saying, arrange your affairs. And that's not where I'm at
Right.
today. I'm happy to report.
It's and absolutely, and quite a difference that made. And did you have trouble when you asked them to have that surgery arranged? Did that did they give you pushback on that? Was there long delays? How did
Well,
that
they
go?
told me it could, yeah, they told me it could be 8 months. And I said, no good. I want on every doctor's waiting list. Any doctor that removes things, I want on their waiting list. And I did get a
Mhm.
call, and they brought me in the week after I got that waiting list phone call. But again, had I said, okay, that's how the system works, that's where I'm at, I wouldn't have been in September. And I was diagnosed September 29th was the day I got that phone call. And I didn't begin treatment until the final days of November. And you can see that's 2 full months, right? So time was everything in my case at 3A already. And if I can just let people know, I had some other symptoms, but unlike Jason, I didn't have a long list of things that I was chasing. And part of that was because throughout the pandemic, I was not on my health situation. I wasn't taking some of those minor symptoms very seriously. And quite frankly, I was caught up in the COVID, the pandemic situation in the healthcare system, in which no doctor was saying to me, hey, how's it going? You got this thing going on, anything else happening that might be related? Nobody asked me the basic questions that might have tied those two parts of what were happening to me together and painted a more accurate picture of how serious my situation was.
And then how was it? How long? You said it was a few months after that when you started the treatment. I think you said in November. How did
Yeah.
that go once the treatment started?
Well, there was a delay of about a week. They set me for treatment, and then they had delays within the system. That was incredibly frustrating and very anxiety producing, as I'm sure you can imagine. But treatment began. I had 2 separate weeks of chemotherapy. So, with my particular kind of colorectal cancer, they wanted to do the radiation and the chemo simultaneously. So, I had 30 radiation treatments over the course of Christmas and New Year's. And during 2 weeks of those, I had one infusion, and each of those 2 weeks, I brought home a pump. So I had mitomycin and 5-FU for my chemotherapy. The chemotherapy is a nightmare. I'm not going to lie. Within hours of that first infusion, I was sick. I was sick, and um,
Right.
all the nausea drugs are out there, and you just have to play around till you find the ones that are right for you. But yeah,
So
it
the
was a
one that
grueling
worked for
6 weeks.
you. Yeah. And
Yeah.
just for our audience, because of the location of the tumor being a little bit lower down, in this particular case, the treatments were a little bit different with mitomycin C versus the standard Folfox or Folfiri plus
Yeah.
bevacizumab that might be used in other cases when it's higher up. But this similarly was treated with radiation. And how were the side effects from the radiation?
Well, for the first 3 weeks, I thought I was cruising, and then Hell Week came. And Hell Week, I mean, we're talking severe burns, and when you're irradiating the pelvis area, the burns are widespread, right? They're all over the genital region, your thighs, your buttocks. It was brutal and difficult. I mean, I didn't leave the house for long periods of time. There was no physical activity because when you're walking around and moving, those burns are irritated. And then once I started to feel better from the burns, which was right on schedule, they basically gave me a timeline of how bad they would get and then when they might get better. And I was right on their timeline, which was great because they could tell me and I could look forward to those
Predict.
milestones. But I
Mhm.
developed an ulcer, in fact, probably lots of ulcers from the radiation burns within my stomach. And that, in fact, I have to be honest with you, was far worse than the chemo and the radiation combined, or any discomfort I was having from my cancerous tumor. The ulcers were grueling and debilitating. Once we got a medication going for that, it took a few weeks to resolve. But yeah,
And
radiation
what
can
was that
burn the inside of the stomach.
what was that medication that was used?
Uh,
You
Sorry,
recall?
off the top of my head, I forget, but it's your
Yeah.
standard ulcer medication which suppresses the stomach acids so that your own stomach acids aren't irritating the radiation burns in your stomach. And my doctor said, I think if we put a scope down there, we'd find your stomach is full of microscopic holes from the radiation burns. So that was extraordinarily difficult. But the good news is, once I mentioned those symptoms, they were on it. But yeah, that was it. Those were difficult
Was
days, and I'm
was
feeling
the
much better
treatment
now.
so was the treatment very effective and quick, or how did that how did that
So, yeah, you do have to wait some time. Radiation for, I know Jason didn't have it, but there's a delay. It stays in your body. I called it the Chernobyl effect. It stays there, and then you wait for it to kick in and do its job. It was always working, but you don't really know until weeks after. So I've had one CT scan that looks very promising. I have an MRI on Wednesday coming up in the coming days, and I think that's going to confirm that we've made excellent progress against this cancer, which was really three areas: the tumor, the adjoining muscle, and then all those lymph nodes. Um, and things are looking good so far. I'm waiting for a couple of tests to just tell me for sure, but things are looking really good.
amazing story, and really, a real good demonstration of how self advocacy can make a difference in your case by acting sooner than later. And really, both you and Jason, that follow up made a huge difference in your care. And fingers crossed for a great scan coming up, and good results in the long term, just as importantly as well. So we're with you, and we're going to come back and
Thank
move
you.
on to Randy right now, who's joined us, Randy Thompson, also from Calgary, as a matter of fact. So colleagues of yours, practically. Randy, why don't you tell us a little bit about your story and what you've been up to in terms of your treatment?
Sure, and thank you for having me. Very appreciate being on this panel. My story goes back to actually the beginning of COVID, back in March 2020, I guess in February, or I had noted a bit of blood in my stool for a couple of weeks. Nothing too drastic. I didn't think much of it, and just attributed it probably to other things that it could be. And um, after about 3 or 4 weeks, it persisted. I had no other symptoms, but I felt there was something probably going on here. So I talked to my GP and recommended we do a fit test, which I did fairly quickly, and failed. Got the results pretty quick. Failed the fit test and was immediately scheduled for a colonoscopy at that point, which didn't take long. I was in fairly quickly. I want to say a couple of weeks from that fit test, and right in the colonoscopy was pretty clear that there was cancer, most likely rectal cancer at that point. And I was admitted into the hospital at that time for further testing to see if there's any other cancer that they were able to see. So all of this pretty quick, to be honest. Ran a bunch of tests the following day, and the next day found out that I was actually stage 4. They had found polyps in my liver. There was tumors, about 30 some tumors that they'd found. So both rectal and liver cancer diagnosed at that time. And I guess the lesson for me was, I had no other symptoms. I would not have known that I had cancer to that degree, except for a bit of blood that was in my stool. And thank God, we acted on that, and had that fit test done. And then once the stage 4 diagnosis was made, the system just your world stops, and the system just seems to kick in medically in terms of what's going to happen next. But I'll tell you, unless you're asking the questions, and thank God I had my wife with me, because you don't hear anything over the next day or two. All you're worried about is, oh my God, I'm going to die, and how am I going to take care of my family? And when we talk about self advocacy, boy, super important if anyone can have someone with them at that time to take better, I would highly recommend. So we we spent a couple of days at the hospital, and then they sent me home without a plan. Although they said they were going to work on it because it was a little more complex than what they had initially thought. And a week and a half, I didn't hear a word from anyone. And can you imagine? And I know you all do, because you've lived it, sitting there wondering what is me and what is happening now and why is there such a delay. So I started making calls, and it was only on, I think, the fifth call I made, I spoke with someone that I hadn't before, who was in the oncology department, who actually had my file and explained to me not only what my diagnosis was, but what my prognosis was, that had not been explained to me that clearly from anyone else, whether it was the doctor who had diagnosed me at the time or the doctors that I had met with while I was in hospital. So now I'm getting all the news, and it's not great, but only because I felt like I had to push to get this information. It's clearly there, and this just some person at the doctor's office is now sharing this with me. So I took the opportunity to ask as many questions as I could around what the treatment plan was, what the end goal was, and worry about my prognosis later. I'm going to survive. So that was kind of an early lesson for me that self advocacy is going to be important here, and not to expect that the information is just going to come to you as quickly as the system kicks in. It's not 100% uh, foolproof for everyone. But you're going to have to ask questions if you want to get the information you're looking for. So
And
I'll
what
just stop
happened
there,
after
Barry.
that? Yeah, well, just what happened after that? You obviously had mets to your liver at this point. You're being told you had stage 4 disease. And believe me, I know that exact moment in my life when that happened to me. I was told I had stage 4. I just fainted actually at the
Yeah,
time. And I always say, well, that was possibly one of the weakest moments of my entire life. When I got up and I decided that I was going to fight, it was also one of the most empowering, one of the strongest moments of my life that carried me forward, up until today. So what happened to you at that point in time when you were kind of knocked down by someone who just randomly gave you your prognosis without even knowing who you were at all? What were your next steps?
yeah, a lot of tears that night. I'll tell you, it was really about. So it seems like we're going to go into chemo, so we have a bit of a plan there. But really, what are we going to do with the family? And it was really about family planning at that point. But the decision was that stage 4, not regardless of the prognosis, I'm going to survive this, and I'm going to do everything I can to survive, right? And if this treatment doesn't work, what about other treatments? And let's make sure we ask those questions. Failing this chemo, and if it doesn't work, what else can we do? Like, where else can we get help? Because you don't know this world until you're in it, right? I mean, cancer is so prevalent here, but until you're in it, you really don't understand the treatments, what's available, what's happening outside of Calgary, outside of Canada. All that becomes super important. So it was really just once you get through that depression period and you make a decision that you're going to live, it's all about what do we do to survive. So we got back on the horn the next morning, and I demanded to speak to my oncologist and have a discussion with her around what my plan is. I don't need to hear odds or anything like that, but what do I need to do, and what to be able to survive? What can I do to up my probability of survival? I can't just rely on medication and on the system. There's got to be stuff I can do here, either internally, physically, mentally, to increase my chance of survival. And not a lot of response there, Barry, to be honest. And once again, showing that it's a medical issue, not a mental issue. And because I have a mental health background, I reached out to some of the folks that I'm familiar with in mental health to help me prepare mentally for what's about to come, because I knew the journey was not going to be it's not going to be a quick one. It's going to be a painful one. So I set myself up with a therapist to help me on the mental health side of things while I was, challenging the medical side with this disease. So that helped me greatly, helped ground me. And once we started chemotherapy, I used, that mental health support as well as the chemo I was getting to help get through my journey. And within 7 months, I responded really well to the chemo, despite the 12 to 15 side effects I was suffering through on a daily basis to get there. I was just so laser focused on a cure and getting better that you do what you need to do to get through those side effects, and able to qualify for surgery because I'd responded so well to the chemo. And the surgery happened in November of 2020.
Right. And I really like and can relate really well to that sort of algorithm approach. If not this, then what? Because that also allows you to think ahead. What might those other alternatives be? How can I qualify for the surgery in your case, or what other treatments might be available? And to question that. And I really, I advocate for knowing, a plan, because number one, it's once you have that plan in mind, that sort of if not this, then what, alternatives lined up, it really helps to reduce the stress, because
Mhm.
you're not going to reach that point where something might not be working and then try to figure it out at that point. So having that long-term plan, or at least understanding some of the other options available, can help to reduce that stress along the way. And your story parallels mine, very much so. Having had those surgeries, those multiple liver surgeries, and so forth. Um, how did the surgeries go?
Yeah, the surgeries went very well. We combined the liver and rectal surgery in the same day, in the same surgery. So we had both surgeons in, probably, I think it was about 7.5 hours, but the surgeries were very successful. And that was of utmost importance. And when we talk about self advocacy, for me, the biggest need was really during that hospital stay, post surgical, to ensure that we're on top of everything that's happening. We're getting the medications that we need, and in the hospital, we're getting everything that we need there as well. So there's just a my lesson learned is don't expect that things are just going to happen, and that all the doctors, because I had so many different surgeons, oncologists, I had nurses, like nurse practitioners, so many different people involved in my journey. Don't expect that they all talk. So it's super important that you're able to kind of broker your treatment and plans between doctors, because they don't necessarily speak. And don't ever assume that they do, that one knows what's happening, because you do get kind of punted from one to the other. And despite health net and despite technology that we have available, the biggest lesson for me was you drive your treatment. You have specialists who will do it for you, but really, as a patient, you need to drive your treatment, um, to ensure that everyone is on the same page. And that would be the message that I could share today, for this event is, yeah, don't assume they're all talking. Take control of your treatment and make sure that everyone is on the same page.
I think that's great advice. And I just want to turn to Jason and Jocelyn. What would your sort of one word of advice be to someone newly diagnosed with either early stage or advanced cancer? you have a message similar to Randy or something different?
Jason?
I think that it's just really important to take your health seriously. So if you think something's wrong with your body, there probably is something wrong with your body. Like look into it
Yeah,
till you get a
I
satisfactory.
think that I think that's great advice, especially if you're a young person and it's not somebody who something you would normally be thinking about. Know your family history, know whether there's a genetic reason, and understand that a family practitioner might not necessarily think of colon cancer as being something when you're under the age of 50 to turn to. So great advice. And Jocelyn.
Well, it's your new job. So you're on leave from whatever you were doing before, right? And cancer is your new job. And you're going to tackle it and you're going to make a list of things and you're going to follow those plans. And when an obstacle presents itself, you've already got your plan B, your plan C. And frankly, my scans are really good. I already have my plan B. I already have my next doctor for recurrence if it happens. So I would say it becomes your number one job and take it seriously, but with a little asterisk, live in today. I'm living in
Mm.
today, living right now.
I think that's fantastic advice from all of you. I wish we had more time. We just ran out of time completely. I know I could speak to all of you all day long and share more stories together. One thing that I do take comfort, even though it's been many years since I was diagnosed with metastatic colon cancer to liver and to lungs in 1995, and I hope that provides some measure of hope to everybody that there is possibilities for long-term cures. Absolutely. It's a whole new ballgame out there. I want you to also know that whether you're a participant watching us today, and of course to our guests today, we are part of one cancer community throughout the country and in fact worldwide, and we are here to stand together and to support each other and help answer any questions that you may have along the way. So thanks so much for being here, and I look forward to seeing you again in the very near future and hearing some great stories from you.
Thanks, Barry.
Thank you.
And Marie?
Thank you.
Well,
Thank you very much. Is there any other builds that Jocelyn, Jason, you would like to add to that?
Yeah.
Jason.
In addition to, of course, like taking questions with me, I often, if I'm not able to have my spouse there, I'll just use my cell phone to record the conversation so that we can listen to it, my spouse and I together. Another thing that I've done is if I do have additional questions, and
Exactly what Randy does. Yeah, I do exactly that.
Do you? Yeah. I'm a little surprised oncologists will allow for recording of conversations. That's,
I mean,
you've all experienced that that's okay.
they really don't
in
have a choice
Calgary,
in provinces. As long as you're
in
party to the
Calgary, there's
conversation.
an app. Sorry,
Yeah.
Jason.
No, I was just saying, like, as long as you're party to the conversation, check your local laws. But broadly speaking, you're allowed to record that, and it certainly helps, especially when when you're dealing with the level of information overload. And then if you don't
Right.
have time to get all your questions in, I'll often, at the end of the appointment, to say, "Can we book like a 15-minute phone call? I just have some questions we didn't get, and I've never
Perfect.
had any issues."
Right. I like how you're all saying that is take charge. And I think on the other side, oncologists, and I hear this oftentimes, they like when people take charge. They like that their people are aiming to manage their own care. A build question that's come in around this topic is, should we be asking for a copy of all of our test results to make sure that we fully understand and are getting the right information? What do you think?
Maybe I could answer that. Sorry before my speaker cut out on me, but all good now. I think that in some provinces, and this is really interesting, you can get electronic copies, for example, in Alberta through Epic and so forth. In other provinces, such as Quebec, it's not so easy. yet. So really, the electronic medical records is just coming, I would say, into reality in some of the provinces in order that we can have easy access to it. But coming back a little bit to your previous question as well, where you can get help in provinces like Quebec is they have what they call a pivot nurse or infirmière pivot, nurse navigator who can help you through this process as well. After you finish asking questions with your physician during a meeting, and if you're lucky to have somebody there with you to make sure that you can report back. One of the things that are really helpful is to speak to that nurse navigator infirmière pivot after the session to provide not only information within the institution and maybe help following up on appointments within the institution so that you're not running all over the place, but also outside resources, can be very helpful with a person like that. And of course, we're here at Colorectal Cancer Canada to help that with that as well and to move that along as well.
Great. Thank you, Barry.
Can I weigh
Yes,
in
of
on
course,
that?
Jocelyn, please. Yeah, please go.
Yeah, I just wanted to let, yeah, I've spent the last 2 months trying to get all my tests. This is really an important point about advocating for self has to start with owning the information about your diagnosis, about your treatment, about your recovery, and about your path forward. So I have spent months working at AHS under pretty difficult circumstances as they attempt to convert to electronic records to try and get not just my reports, but my images. That's actually the harder thing to get. So that if I need to share them down the road with any other doctor, I'm nimble and able to do that. So I encourage every patient, the minute you have a scan, make the request for not just the report, and then uploaded them to other medical experts. So I've been there. You can DM me on social media directly, and I will help walk you through that process.
Jocelyn, thank you so much. And I want to make sure that everybody really captures, first of all, how do they DM you? Do you want to just call it out for everybody and we'll make sure it goes into the chat?
Yeah, so I'm CTVJ Laidlaw on Twitter, and on Instagram, I'm CTV Jocelyn Laidlaw. And so
Thank you
just
very
reach
much.
out to me on public on both
What
accounts. And I'm
an
happy to walk
incredibly,
people through that process. It was pretty challenging. Yeah.
I'm sure it was.
Jocelyn, how did you access them? Did you go to medical records and fill out forms and requesting it? How did you access those documents
Okay,
and
so
fill them
this is it.
out?
I'll try, yeah, the story short, but basically
Yeah.
AHS, every department I went to, AHS had a different form. So I would have an MRI, CT, I had a colonoscopy, I had a PET scan. They all wanted something different to release. I had two groups of people I wanted those records released to, two sets of medical professionals for second opinions. Both were outside of Canada, as an aside. I had to fill out forms multiple times, and even following the instructions on the forms, that didn't always work. I eventually was in contact with the record at AHS, and I told them exactly what I needed in a very long and detailed email. And I have to be honest, I had to demand help. I had to demand it. It was not easy. And when they realized I was somebody going away, my records, which belonged to me, helped me. It technically challenging. I needed my husband and a computer with, we actually bought an drive, images from your CT, your PETs, your MRIs. They take up lots of space. They're massive, thousands of slices of images. So once I got those, then I was able to upload them to those other medical professionals outside of the country. But this is an important thing. You own those images, and they're the key to getting a second opinion and to knowing what's happening moving forward. So I encourage everyone to try to get all their records. And if you do it as they're coming in, it's less onerous at the end than trying to get 6 or 7 studies at one time.
Yeah, thank you. I think it's
you got the actual download of them rather than a hard CD of it. And
Yes.
I guess I'm getting old fashioned, but that's the way I got them on CDs. They were easier to ship. I'm wondering if Randy and Jason had the same experience getting copies.
Mine was a lot easier. My hospital, the Kingston Health Science Center, they actually use Pocket Health, so I get all of my imaging and the reports that go with my imaging. But getting pathology and other reports is a bit more tricky. Um, the one thing that I will say is that because I do have a family doctor, he's been able to print off copies without having to go through medical records for things like pathology and some of the different testing that's been done on my tumor. So I would just say like it varies, and sometimes if you don't know who to ask, like even if if you've got a GP, give them a shout. They might be able to just run you off a copy next time you're in getting your prescriptions filled.
Mm. Thank you. I wish we had left more time for Q&A in this session, because clearly there's a lot coming in. We're at time now. I'm going to have to thank Randy, Jocelyn, Jason, and Barry for a wonderful session and for openly and honestly answering all of the questions from the audience.